Good evening. Thanks for joining us. I'm Calista Solon, and you're watching NLC Trans. Tonight I'm here with my dear friends and co-hosts, Tara Alexander and Renee Benoit. And we have a very special guest for you tonight. We have Sean Lang, and you are the Director of Public Policy with the Connecticut AIDS Resource Coalition.
That's right.
Which is certainly a cause that, that is very near and dear to our hearts. Maybe you could give our audience a kind of a overview of your organization and what it is that you do and what it is that you do specifically.
Sure. I mean, CARC's been around for 20 years now. We're commemorating the 20th year of our service in the community. We began in the late 80s. And I'll even backtrack a little bit back to that. You know, in the early 80s when AIDS first came on the scene, AIDS projects sprung up all across the country, and Connecticut was no different.
Sure.
You know, the first AIDS projects began here in Connecticut in like 84, 85. A few years into the epidemic, after those projects established themselves, and you know, probably many of you remember, you know, we were ministering to the sick and dying. We were quelling the fears of community. We were, you know, holding the hands of family members and lovers as, you know, more and more information about HIV and AIDS came out. And as those programs stabilized in the later 80s, we began to see homelessness among people with HIV and AIDS. And in those early years, the AIDS housing movement is primarily because people got too sick to work.
Sure.
So they lost their jobs, they lost their livelihood, they lost their homes, or through discrimination and stigma, you know, by family, friends, lovers, partners, husbands, wives, who didn't want to deal with somebody with HIV and kick them out, so people lost their homes in that respect. So AIDS housing programs began to respond to that particular crisis by starting lots of different types of AIDS housing programs, group residences where people live, you know, in a congregate setting with shared kitchen, shared living room, and what we call scattered site housing programs, where people have their own apartment, they get a rent subsidy and support services through a program, but they live it more independently. And you know, and as the disease changed over the years, and Connecticut is a little unusual than some other states around the country because the majority of our folks were infected through injecting drug use. So that put a spin on sort of how the programs evolved and the types of services and support they offered people. So, you know, in the late 80s, around 88, a small group of providers came together and said, you know, we're seeing this issue and this problem, and we're beginning to provide housing. We should pull together to be able to provide support to each other and, you know, basically develop this as we evolve. So they formed the Connecticut AIDS Residents Coalition, which incorporated in 1989. And I came on board in 1990 as the interim executive director when she was going on leave for parental leave. And they brought me on specifically to do some strategic planning with the organization and develop, which did become the first in the nation, standards of care for AIDS housing programs. So I've held a number of positions with the organization. I've been the interim executive director 3 times. But I'm primarily responsible for all the advocacy and legislative activities of the coalition, both on the state and federal levels. So on the state level, I co-chair our AIDS advocacy group, which is called the AIDS Life Campaign, and that stands for the AIDS Legislative Initiative and Funding Effort. And we started that, I think, back in 1990, maybe 91. And it's comprised of Department of Public Health folks, AIDS advocates, activists, people living with HIV and AIDS, people who run AIDS service organizations. And what we do is, around this time of year, we start forming our legislative agenda for the upcoming legislative session. And then once the session begins, we develop strategies to try to forward that agenda. You know, and it's always it's kind of a minefield, legislative session, because you know we can set an agenda, but then the governor's budget comes out, and we kind of have to throw it all out the window and start all over again, because there might be other things we have to address, you know, in particular budget cuts, which has been a real issue in the last few years.
Which is really unfortunate. Certainly, It seems, I've made this observation before, I know it seems like in recent years people have sort of forgotten that AIDS is still out there, and budget cuts are not a good thing. AIDS is still there and it's not going away.
It's true, and we're seeing emergent infection rates among men who have sex with men, particularly younger men of color in that community, and among women of color. So, while, we could sort of think we've done a pretty good job, we've seen newly reported HIV and AIDS cases drop in the state.
Mm-hmm.
So, but at the same time, we've seen a rise in newly reported cases among these particular populations. Right. So we have a statewide HIV planning consortium, and we're really directly in the throes of developing what's called our statewide coordinated statement of need, but basically the plan to address HIV prevention issues. So, right. And that's done by looking at all the data, all different types of data to see where the infection rates are rising and where we should put the greatest amount of resources.
Right. It's certainly an issue that we've talked about on the show before. We have a local organization, the Alliance for Living, which is with Sandy Brindamore, who comes on the show on a regular basis.
They're terrific.
And they are affiliated with your organization.
Yep, they're a member of the organization, and Sandy's on the board of CARC. We've worked closely with them for years. I mean, because I go back so far with the organization, I remember that when they were CCAP, the Southeastern Connecticut AIDS Project, so that shows you how old I am. But yeah, they're a really terrific organization that does really great work, and they enjoy a lot of support from their state legislative delegation. They're very involved. In fact, I ran into Senator Andrea Stillman at the Dan Malloy party, the victory party last week, and just said to her, I've always really appreciated how much support you've given to HIV and AIDS in general, but I know how tied in she is with the Alliance.
Right. I believe we met her at one of the Alliance fundraisers, in fact.
Yeah. They always go to the fundraiser. I went to one a few years ago, and almost the entire delegation was there, which is really impressive.
Yeah. But the whole AIDS thing is very, very scary. And I was around when it first started.
In the early years.
And it was one of those things that back in those days it was this huge scare.
Scary.
Mm-hmm.
And everybody was really scared to death, and a lot of behaviors sort of stopped. Well, I don't know that they'd necessarily stopped, but things changed a bit back in those days because everybody was so afraid of it. And it seems like in recent years, there's more of a kind of a complacency that, and it's sort of fallen out of the news. You don't hear about AIDS so much, but it's still there, and the numbers are still very large. And we don't have a cure for it yet.
Right. I mean, we have over 10,000 people that we know to be living with HIV and AIDS in the state of Connecticut. And the Centers for Disease Control estimates that about 25% of people who are infected are unaware of their status.
That's really scary.
It's very scary because a lot of the research is showing that when people are newly infected, their viral load is very high. And that's when they're much more likely to transmit HIV to somebody else because they don't know their status. Their viral load's really high. And, they're still engaging in higher risk behaviors because they don't know they're positive. So there's a big push on the federal level, and we actually set up a working group to address this in Connecticut. We've only met one time so far to figure out how to do more targeted outreach, test people who aren't aware of their status, and get them into treatment. Because when people get into treatment and they stay in treatment, they're taking the medications, their viral load goes down, and they're much less likely to infect somebody even if they engage in high-risk behavior.
Right. And certainly the medications are very serious for AIDS and HIV. I don't know a lot about it, but I know that it's the sort of the drug cocktail is nothing to sneeze at.
No, and I think that's part of for the younger generation who didn't grow up watching all of their friends die.
Yeah.
they don't know what that was like, and I don't want anybody to have to live through what we lived through back then. However, I think two things. One, to your point, when we first became aware of HIV and AIDS, it scared the hell out of us, in lots of respects. I mean, I remember sitting in the Student Union building back in college, reading the first reports about HIV in the Gay Community News out of Boston, and really there was this really visceral reaction in our little LGBT community about it because they didn't know what caused it at the time. So this was 81. There were reports that poppers might have been, involved. Amyl nitrate was a recreational drug. I'm sure people still do it, but it was very popular back, in the 80s. And at that time, nobody in our little community had gotten sick or died. Fast forward 30 years, we had a reunion of that group last October, and we found at least 5 guys who had died of HIV or AIDS, and there's some others that are infected, so it really hits close to home. But to the medication, I mean, it's great that there are these medications out there, and they make a huge difference in people's lives. I mean, people, are living longer, their quality of life is improved, and they're incredibly toxic. I mean, most people take a handful of HIV meds, and they take a handful of other meds to counteract the side effects of their HIV meds. So it is no picnic, and some you take with meals, not with meals, once a day, 3 times a day. This is refrigerated. This isn't, and it causes problems for folks who, are marginalized in lots of different ways. I mean, the issue of poverty plays into HIV infections as well. I mean, we know that, folks who are homeless, who are living in shelters or transitional living programs may not have access to HIV meds because they don't have any place to store them. And that places them at greater risk. We also know through reams of research that when people are homeless or precariously housed, they're far less likely to be in care, they're far less likely to stay on their meds, and they're much more likely to engage in high-risk behavior because they're living in a much riskier context than someone who's stably housed. So, we've